Thank you and welcome to the show this morning. The topic this morning is kidney disease and diabetes. And we're fortunate to have with us to talk about kidney disease and diabetes, Dr. Marquetta Faulkner. Dr. Faulkner is an internalist at Meharry Medical College. And of course, Dr. Faulkner, let me welcome you to the show this morning.
Thank you, thank you.
And Dr. Faulkner, I don't think that by any means you are a stranger to any of our audience, because you've been with us on many occasions, and I think you've given us excellent information each time. And what we'd like to do today is to talk about what I consider to be a very, very important health issue, not only among African Americans, but among the general American population, and that is diabetes and kidney disease. But before we get into that, Dr. Faulkner, let's have you to give some members of our audience who might not know you, and I don't think that there are many who do not know you, but let's give you an opportunity to give them some information about your background, your education, and some of the things that were important in eventually leading you to Meharry Medical College.
Okay, well, I'm a graduate of Texas Southern University. That's where I got my BS degree. Then I went on from there to Meharry Medical College, and I did my residency there as well after I graduated from Meharry. And from there I did public health, and then I was interested in kidney diseases, so I went on to New York, to Long Island Jewish, to do kidney diseases. Then I returned to Meharry in 1989 to build the division of nephrology there.
And so you've been at Meharry since 1989,
That's right.
Involved primarily with
Kidney
disease. And that appears to be a very, very important topic now when we talk about kidney disease and diabetes. Let's look at both these instances of malfunctioning of the body or whatever. But when you talk about diabetes, what are you talking about?
Well, you're talking about an abnormal rise in your blood sugar that should normalize after you eat a meal. If it doesn't normalize, then it's considered to be diabetes.
And that leads to what, a high elevation of real problems.
Yes, that leads to several in-organ problems, and one is kidney disease. And kidney disease is very prevalent in the African American community. We're quite a bit of the end-stage renal disease population. We're probably a third of the end-stage renal disease population, meaning those who are on dialysis. And the number one cause is diabetes mellitus.
And so when you say we're a third, do you mean that African Americans represent a third of the individuals who have this?
Yes.
That's an extraordinary number of individuals, considering that we make up, what, less than 13% of the population?
Exactly. We're 12% of the population, but we are 30% of the end-stage renal disease population.
Now that creates a real problem for the health care system as well as for African Americans, isn't it?
Oh yes, oh yes. And we're probably around 50% of the end-stage renal disease population in Tennessee.
And so there's a real problem. The issue that we're dealing with this morning is something that a large number of people in our audience this morning might be affected by. Is that what?
Exactly. 8.3 million people in the United States of America have kidney problems, and they may not know it because it is so subtle. You don't get any signs of kidney problems until very late in the disease.
And so this is another one of those so-called hidden diseases that it's hard to detect, but by the time you detect it, you might be having some real problems.
Oh yes, oh yes, because you can't reverse kidney disease. Kidney disease that's chronic is not reversible. So what we try to do is arrest the kidney disease from progressing any further once we find out that you have it.
And so there's no possibility of having a little kidney disease and then reversing it and it disappearing. Is that what we're saying? Is that when you
if you have acute renal failure, that means you have some injury to your kidney, and you can recover from that. Yes, you can recover. But if you have chronic disease, such that you see with diabetes and high blood pressure, you cannot recover that.
And so you find a large number of individuals that you deal with fall into that second category.
Oh yes, because I'm a kidney specialist. So, about 70% of the patients I deal with fall into that category.
And so that's a daily kind of thing of you dealing with folks primarily with kidney disease.
Oh yes,
Mm-hmm.
it's daily for me.
Mm-hmm, mm-hmm. And now, do you think that there's enough resources and enough aid in terms of dealing with that? And of course, I know that that's a question that I shouldn't ask as we get ready for this second commercial break, but first commercial break. But let's think about that, because when we come back, I do want you to address that problem about the resources that are necessary, because I think that a disease like that and the discrepancies between individuals will play a very, very significant role. And we'll be back with our audience following this very, very short commercial break. And the issue is